Hi, Emily. I had postpartum depression and kind of like a mix of anxiety and panic disorders as well. Postpartum depression is a form of depression that can hit during, which is prenatal depression, or typically within 4 to 6 weeks after having a baby. It should typically start, but it can take months to actually appear. A lot of the symptoms that people have are feeling rejected just because the baby cries so much that they can't stop the baby from crying and they feel like they're doing something wrong, or rejected by their partner because their partner's tired or working and taking care of a baby and coming home and it's just a mess. They can be restless, they can't sleep, they're exhausted but they can't sleep, which kind of triggers like an anxiety feeling because nobody runs good on no sleep. Loss of appetite, feeling suicidal, wanting to hurt themselves, their baby, or anybody else. We can't really do much as EMTs to help them besides just making sure that they can trust us and making them comfortable and bringing them to the hospital where they can get medications like SSRI, antidepressants, anti-anxiety, counseling. They can do all of that. People more at risk are somebody who had depression prior to getting pregnant, somebody that goes through a hard, stressful time during pregnancy or right afterwards. Like if their partner were to leave, they lost a job, the baby's sick, they get sick. There's kind of a lot of different factors that can play a role in it, but especially people who had anxiety or depression right before they had the baby or during their pregnancy. I'd say during the assessment, some good tips would be to not come at them saying, oh, well, you must have depression, or do you have depression, or what's wrong with you? Kind of just listen and try and help as much as you can to keep them comfortable and build that trust within the EMT and patient relationship. But just don't get too involved because then it's not good. If they're having an anxiety or panic attack due to postpartum depression, their heart rate would be increased, their respirations would be increased greatly. Their temperature during a panic attack, people's temperature can actually go a little bit higher than normal. I wouldn't really call it a fever, but it would go up a degree or two. Just from panicking, they get warm pretty quick. I think that's really all I could find. It's kind of a complicated thing to talk about because there's so many different variations that come in so many different kinds of patients that you can't narrow it down to one sign or symptom for everybody. It just doesn't work like that. Yeah, I think that's really all I had. If I remember something, I'll update it, but I think that's it. Thank you. Bye, Emily.